Our final diagnostic category is food sensitivity testing, and unlike celiac disease, which is autoimmune based, food reactions can be immune mediated hypersensitivities or even just digestive intolerances. Our job as clinicians is to differentiate between allergy, sensitivity, and intolerance because management would potentially be different for all three. Food reactions will typically then fall into these three major categories. A food allergy, which is a type 1 hypersensitivity, IgA mediated, immediate symptoms, and could be anaphylactic. Food intolerance, which is an enzymatic deficiency. This could be like a lactase deficiency, non-immune based. Or a food sensitivity. This is often a delayed type 4 IgG mediated response where symptoms last hours to days later. And this section is going to focus on identifying food sensitivities, this latter type, these type 4 delayed hypersensitivities, when testing could be helpful versus when an elimination diet remains the gold standard. So looking at kind of these different pictures, type 1 hypersensitivity reactions, remember, are IgE mediated. They occur within minutes. They're hives, anaphylaxis, swelling, asthma, vomiting. In contrast, though, a type 4 or delayed hypersensitivity reaction is mediated by IgG, particularly IgG4, and can take up to 72 hours to appear. These reactions can cause fatigue, eczema, headaches, mood changes, and joint pain or GI symptoms. And this delay makes it difficult for patients to connect symptoms to a triggering food without structured testing or elimination trials. Looking at kind of food sensitivity testing, the gold standard is truly the elimination diet. So before I consider doing any food sensitivity testing, I'm considering, is my patient a candidate for the elimination diet for 6 weeks? Patients will remove the most common food triggers for 4 to 6 weeks, or foods that maybe they suspect are food triggers. They then reintroduce these foods individually every 3 days, tracking symptoms. While it is extremely accurate, it can be difficult for some patients. And testing could help guide or sometimes narrow the list of foods used in elimination, but it will never replace careful clinical reintroduction. So if we ever do food sensitivity testing, I'm still considering an elimination diet after those results. Food sensitivity panels are performed using ELISA testing, which measures IgG or IgG4 antibodies against specific food antigens. High IgG4 does not always equal pathology. IgG4 may also indicate just exposure or tolerance. Because antibodies can persist for weeks to months, elevated IgG levels reflect immune activity, not immediate reactivity, which is why results can always have to be interpreted alongside histories and symptoms, not just in isolation. Now, IgG versus IgE differ dramatically in circulation time. IgE's half-life is 1 to 2 days, and mast cell binding lasts only about 2 weeks, versus IgG4 has a half-life of 21 days, and mast cell binding can present or persist up to 2 to 3 months, which helps explain why delayed reactions are very challenging to track without structured elimination. Labs can test up to 96 foods or more, but again, clinical context is really important. This here is showing kind of what it would look like if you received a food sensitivity test. This is one specific type of food sensitivity test, and it's showing the reactivity level here is increased, indicating that there was a higher level of those IgG antibodies present. And this looks like it's a compare and contrast between potentially IgG, IgA, and maybe IgE antibodies, although it's hard to tell because they didn't give us that appropriate information. So again, going back to here, um, both IgG and IgE antibodies are detected using ELISA methodology using purified food antigens. IgE testing is more valuable when we suspect an immediate hypersensitivity reaction, especially if you're getting symptoms like hives, airway involvement, or rapid onset, versus IgG testing gives us information about repeated exposure and delayed reactions. Panels can vary, but you can, again, like I said, test up to 96 foods or more. But IgG elevation, so like seeing these being elevated here, does not really always indicate that there's an immune problem with this food. So we need to correlate clinically. Time is also an important thing to consider. The time window of immune activation. IgE antibodies will bind mast cells for up to 14 days, which is why immediate allergies produce rapid and intense symptoms, versus our IgG4 antibodies can circulate for greater than 3 weeks and bind for up to 2 to 3 months. So a delayed food sensitivity symptom can occur days later, making them more challenging for patients to identify. This is why when we do a reintroduction diet, we have to only introduce a food every 72 hours. It has to be slow because we not want to make sure there's no cross reactivity. So understanding our terminology here, our food allergies are going to be immune mediated and IgE. A food intolerance is going to be an enzyme mediated reaction like a lactose issue. So like we don't have our lactase enzyme. So we're lactose intolerant. And then food sensitivities are immune mediated and IgG based. They are systemic symptoms. They could include even things like fatigue or headaches, even joint pain, mood changes, eczema, weight changes, and of course, GI symptoms. The intensity of symptoms is related to the frequency of antigen exposure, and clinical management includes gut healing, elimination, reintroduction, and identification of contributing factors like dysbiosis or increased gut permeability. So ultimately, we can have way more discussion about food sensitivities and food allergies, and we will. Next week, we're going to lean into a couple examples of when we would consider these tests or when we would potentially consider other types of management, such as an elimination diet, et cetera, et cetera.